Nigeria is said to be battling with an estimated 2.3 million children who lack access to or are never reached by routine immunization services. This category of children, also known as zero-dose children, is a source of concern according to the World Health Organization. In a concerted effort to eliminate the threat of zero-dose children in the country, the African Health Budget Network, in partnership with the Borno State Primary Healthcare Development Board, is set to unveil a transformative initiative in Borno State amidst concerns of resistance. Now, News Central's Umaru Kirawa tells us more.
Garba Abdu, an elderly person from Borno State in Nigeria's northeast. He is one of the elderly who do not believe generally in immunization and opens up on reasons.
In ka je asibiti da a rubuta maka magani ne a ce ka je ka saya babu magani a asibiti to amma sai aka zo aka ce wai ga magani an kawo muku kyauta ku je ku karba kuma aka ce baya da illa ta yaya zai shiga kaina wannan
ko yanzu paracetamol wannan man ka tabi asibitin ma sai dai da kudin ka zaka saya bara ba ka kyauta ba to ne me ne wannan din za a dinga ba mutane kyauta.
The joy of getting a child is a story in itself, and ensuring the child receives the necessary vaccinations to protect them from preventable diseases is another story.
Kuma mu mutanen mu da yake suna da kuɗi ana ba su kuɗi sai suna cewa ai an bincika an gani wannan rigakafin baya da illa wallahi yana da illa.
The fight against zero-dose children in Borno State is the essence of this multi-stakeholder engagement, with the launch of the Community of Practice on Immunization Budget Tracking, Accountability and Sustainability.
This is a big issue that we need to come together as a community of practice and community of actors to ensure that we deal with this problem and we reduce the outbreak of vaccine-preventable diseases like diphtheria, measles that we keep dealing with.
All my children are fully vaccinated, and there are so many other doctors, nurses that attended this program today, and I'm sure they don't have that aspect. So we have to interact with the community, we have to interact with the policymakers, we have to interact with the government officials to ensure that no stone is left unturned.
This initiative, spearheaded by the African Health Budget Network in partnership with the Borno State Primary Healthcare Development Board, aims to champion the cause of eliminating zero-dose children.
The whole primary health care is depending on what? Immunization. We are always talking about immunization, and a lot of resources going to the LGA. Who are the LGAs? The community. So if you look at it, this is a very important launching, or this is a very important topic to address our problems.
Most of the measles cases that we're having, measles, diphtheria cases are coming from the zero-dose children because the children are vulnerable. They have not been protected by any form of vaccines. So any other disease of under 5 usually tackles them first.
When a lot of people don't take immunization, the herd immunity is reduced, and then we put every other person at risk, even those that have taken the vaccine.
We should be committed because this is a service to humanity, and majority of us are used to this service for over 2 decades.
Experts during the engagement emphasized the need for enhanced retraining to community health workers as a major step to improve immunization performance.
When an objective is set, our intention is to ensure that we make it happen. So yes, true, we are going to bring down drastically. We're already bringing down the number of zero-dose children.
The journey of changing the mindset and reducing the zero-dose children in both rural and urban communities seems to require more efforts in sensitization and advocacy, among others. In Maiduguri for News Central, Umaru Kirawa.
The death toll from a recent attack by suspected Islamic rebels in Eastern Democratic Republic of Congo has tragically risen to 41. The update was provided by Congolese Army spokesperson, who disclosed that the attack carried out on Friday